Now on to 935 CMR 501, medical use of marijuana. We're going to do this exactly the same way we did it for adult use, which is I will walk through the definitions one by one, but then for all the other sections, I'll just ask for comments. We again will take a vote on an individual regulation or change only if there doesn't seem to be consensus or if it's, in my opinion, a significant change. Otherwise, we'll vote on the regulations as a whole, again, with the authority to the General Counsel to make ministerial and other changes necessary to public. Yes, go ahead.
Chairman, may I suggest there's significant continuity in the definitional section between the adult and the medical
So
use.
you want to just focus on the ones that
or alternatively, you could ask your fellow commissioners if there's any particular definitions on the medical side that they would like to focus
fair
on.
enough. Thank you. So let us get started, and the first section, and again, I'm going to omit CMR 935 501 and just go dot through the section. So starting with dot 001 purpose, I will take the suggestion of General Counsel on dot 002 definitions and just ask, are there any issues with any of the definitions that my fellow commissioners would like to raise?
Mr. Chairman?
Commissioner Doyle?
Consistent with the issue I brought up in the adult use regulations, I think at least the definition of individual order would preclude the opportunity of anyone other than a marijuana treatment center from delivering to a patient, and so I'd just like, consistent with our prior discussion and vote,
make the same
to
change.
perhaps, evaluate the medical regs to make the accommodation.
That's fine. Any objections to that? Thank you. Any other comments on definitions? Okay. And I just do want to comment or thank our legal staff and our general counsel. The fact that we just got through that without any questions, or at least other than one question, I think that's great. So thank you for the work and kind of making it consistent with adult use. Appreciate that. Let's move on to dot 005, which are fees. Any comments on fees? Yes, Mr. Executive Director.
Just worth noting that this draft does contain.
The microphone's.
Just worth noting that this draft does contain the elimination of the patient fee.
The elimination of the patient fee. Yes, I saw that, and I appreciate that.
I should say the registration fee. However, there's still other fees associated. For instance, if there's a replacement card or something, as far as their own cost. But the $50 registration fee has been removed.
Yep. Thank you.
Didn't want to gloss over
No,
that.
I appreciate you pointing that out, Mr. Executive Director. Any other comments on fees? Dot 006, registration of certifying physicians. Okay. Dot 007, registration of certified nurse practitioners.
Mr. Chairman?
Yes, Commissioner Doyle?
I apologize. I just
Do you have a
realized-
definition issue or fee?
No, in the adult regs, we had discussed healthcare provider and clinician, and I realized I forgot to carry that forward to the medical regs.
Go ahead, General Counsel.
Yes, may I suggest, Chairman and Commissioner Doyle, to the extent that changes have been made on the adult side, I'll assume that they should be made on the medical
Well,
side.
yeah, that's fine, but let's, we should bring them up just to make sure there's nothing that gets lost in translation, but, so that's fine, we'll do that.
Yeah, that's,
Thank you for that catch. So we are back at dot 107, registration of certified nurse practitioners. Dot 008, registration of certifying physician assistants. Dot 010, written certification of a debilitating medical condition for a qualifying patient. Dot 015, temporary and annual registration of qualifying patients. .020, temporary and annual registration of personal caregivers. .021, registration of caregiving institutions. .022, registration of institutional caregivers. .025, responsibilities of caregivers. .027, hardship cultivation registration. .029, registration of independent testing laboratory agents.
Is this going to be something that we review upon complaint, or how is that done?
I'm sorry, you're in .032?
I thought I was.
I'm not seeing what you're talking about. I'm sorry, I apologize. This is revocation of registration card or hardship cultivation registration. I don't see, I'm sorry, I just don't see what you're referring to yet. I understand, I think I understand your point. I just don't see what you're referring to.
Go for it.
Maybe I got the wrong section. Oh, maybe it was eliminated. I don't see it.
Okay.
Is that in,
Paul,
is that in
you-
2B?
To be taking into account the amounts of marijuana products or MIPS obtained by his or her personal caregiver, seeks to obtain more of such amounts than is allowable under 935 CMR 501.105. Is that your concern? So that's 2B, page
I see.
39, I think.
And may I ask for a point of clarification? Is the issue that this is the language seeks to obtain, in terms of how would we be able to discern if somebody has reached their allotment and in addition to that tries to acquire more than that?
No, I know how we track how people reach their allotment. I'm just worried that, someone may get, I'm concerned that someone may be the subject of action by our people when they just got confused. So I'm just kind of looking for how are we going to be handling this? Because this seems a bit
Could allow
challenging
for-
to enforce.
And it seems, as it reads here, it could allow for an unintentional result, so maybe some sort of language on intentionality.
Yeah, if that will
Yeah.
work, I'd appreciate it.
Yeah, my understanding of this provision is trying to capture some of the concerns about diversion that might emerge around the temporary
And suggest
registration.
language.
So if we change the language just to reflect.
Yes,
I'm sorry,
we'll do
Commissioner
that.
Pride?
Right, has a
So after obtained by his or her personal caregiver, if applicable, knowingly and with intention to subvert this regulation.
Right. If that works. Are we okay with that?
Yeah.
Got that, General Counsel? Great. Anything else in this section? Thank you, Commissioner McBride. .033, void registration cards.
Mr. Chairman,
Yes, Commissioner Tuttle?
I apologize. There was an
Where-
earlier
Where
section.
are you dreading us back to?
Yes.
What section?
Okay, hold on. I lost it.
You get two of these, by the way, so use them wisely.
That's fair. That's totally fair. It's under hardship cultivation registration.
So we're still in, this is not revocation.
This is 501.027.
027, great. Give me a second, please. Okay, and then what subsection?
12.
12, okay. So Commission may inspect the cultivation site of a registered qualifying patient with a hardship cultivation registration.
Yes.
Go ahead.
So I wanted to suggest that the patient be able to receive notice before the inspection.
Hear from the enforcement staff on that? Is there any issue from the enforcement staff's perspective?
So this, to be candid, this is hardship cultivation is not something that we're currently dealing with.
Right.
I think the concern would be that of diversion if someone were using
Sure.
the hardship cultivation.
No, I think the basic issue is should we give notice before an inspection? I mean, I don't think anybody's arguing that we should not have the right to inspect. The question is, should we give notice, and if so, how much?
I think that would be.
Does enforcement have a perspective on this?
No, I agree with what you just said. I mean, part of the compliance piece is to make sure there aren't any diversions. That's why we're trying to ensure that there's compliance. So that's the reason why
Okay.
I would be concerned, we would be concerned with those,
Okay. Thank you, yeah. Do you have a suggestion, Commissioner Channel?
Mr. Chairman, I'm
Yes.
sorry, I couldn't hear Mr.
I think if I tell me if I get this wrong, what Yandra said was that the objective here is to ensure that we have the ability to prevent diversion through these inspections, and I said I agree with that. The only, I think, no, I think nobody's arguing that we shouldn't have the right to inspect. The question is, should we give notice to a patient prior to inspection, and if so, how much notice? That to me seems like I really value the opinion of our enforcement counsel on that.
Perhaps, perhaps we could, modify something in a way that says, shall provide notice, unless, and I'm thinking of some sort of standard for law enforcement having a concern about diversion. So if there's, an actual concern about criminal diversion, that this language wouldn't prohibit law enforcement and, perhaps the commission working in conjunction on a criminal diversion matter, but for the regular course of folks, prior notice would be something that seems reasonable.
That's that, Commissioner Tuttle.
I think that's an improvement I would appreciate.
Okay, so we're going to change this to say that notice is required except in cases where there's an imminent law enforcement action required. Or, yeah, you'll work out the language. Do we want to talk about how much notice is required?
I'd be fine with reasonable notice.
Reasonable notice? Everybody okay with that? Okay. You have a problem, Commissioner Fleming?
I have a problem with notice at all, because I think there's a true risk for diversion in some cases, and it's not, once you get your notice, it's not hard to get rid of what you're trying to get rid of, but if I'm in the minority in that, I understand.
Would you like to make a motion? Or just go ahead, Commissioner Flanagan.
No, I'll do it when we go to after draft.
Okay, so reasonable notice is what we're going to put in there. Okay, great, thank you. Now I got to remember how far we had advanced before we got dragged back, but...
Sorry.
I think we were done.
You wish. Okay, motion to adjourn?
I believe you were on .033. Board.
I think that's correct,
Yes.
thank you. So, .033 board registration cards. .034 revocation of certifying healthcare provider registration. .305 void certifying physician registration. .050 medical marijuana treatment centers.
Mr.
Yeah,
Chairman.
this one I thought we'd get some action on. Go ahead, Commissioner Doyle.
Well, it's very minor action. Subsection H
Under one?
One.
Yeah. Mm-hmm.
includes a provision that an MTC must make vaporizers
Right.
available for sale. In 2013, when this was put in the medical regulations, vaporizers were less common, and if memory serves, and I didn't draft the medical use of marijuana regulations, but I believe I was told it was an attempt to disincentivize smoking and encourage vaping as an alternative. I think vaping's relatively common now, so I don't know if this requirement is needed anymore, and maybe we can allow them to make their own business determination. And if people think this is too policy-laden, we can put it off to the fall so people can think about it. But I just,
What's the smile about?
That you were open-minded about them making their own business decisions.
No, of course I'm surprised. I don't have to make a comment here, it's obvious, but can I get comments from the other commissioners? Any? So you're suggesting, Commissioner Durrell, that we take this out altogether, this requirement in H?
yeah.
Any objections to that?
I agree with Commissioner Doyle.
Okay, so we're going to take section H out. Thank you. Any other comments on this section?
Yes. Mr. Chairman?
Yes,
if I may.
please.
050 subsection 4B, and this is an issue that's actually sprinkled throughout the regulations that I just flagged right before this meeting
Yep.
for the legal team. There are a lot of references to home deliveries, and I believe institutional caregivers can only take deliveries at their institution, not at home. So I just want to ask the legal team to do one more run through the regulations and just make sure where we're referring to home delivery, it's limited to personal caregivers, and where we're referring to institutional caregivers, that the home part be eliminated and
It's the
delivery.
institution.
Yeah.
Yep, that's great.
That's
Commissioner,
fine. So just to be clear, the commission is in agreement that we're going to continue to recognize institutional deliveries as well. Okay, great.
Okay, any objections, issues? Anything else in 050?
Mr. Chairman, if I may.
Yes, Mr. Executive Director.
Just for point of clarification, and I think it's worth noting, is we're attempting to capture the tier of medical marijuana treatment centers. We're not, the licensing fee remains the same regardless of the tier, but it's really a data point for us to make sure we're maintaining.
Right.
And that if they're going to be co-located, that the tier is going to be counted against both facilities. So for instance, a 100,000 square foot canopy would not be a 50,000 adult use, 50,000 medical would be co-located. But it's really an attempt on our part just to get a better sense of what the canopy statewide, in fact, would be as operational.
Okay.
So,
I want to keep the clarification. Anything else in 050? Okay. .052, independent testing laboratories. Okay. Thank you. .100, moving right into .101, application for licensing of medical marijuana treatment centers, application requirements.
if I may.
Yes, please,
Again,
Mr. You're always welcome.
Again, just for clarification, that as you may recall, we are optimistic that we can bring the medical application into the portal.
Yes.
We do set a date in these draft regs as far as September 30th.
September 30th?
September 30th of this calendar
Right.
year, by which we think we can launch the application
Right.
portal. We would, anything prior to that day would be honored through the traditional process
Right.
that we have today.
But what if we're not able to make that date, which, I hope is a remote possibility, but is there language in the regulations that,
The way it reads is on or after.
On or after, so, okay.
It's
Yep.
aspirational on our part. And I failed to mention in the fee context as well, that when this change occurs, and from a medical fee standpoint, is they would submit one application to the commission at once, not be invited to each different
Right.
round. As a result, the fee structure has changed to.
yeah, no,
to
I
accommodate
think we've
that. So-
discussed, that was discussed in our policy discussion, if I recall
It was,
correctly.
so it's maintained here, but I just wanted to be clear that our intention is still to move that application into the portal, and thus bring all of our applications under one, through one mechanism, so I think this is an attempt on our part to do that.
Okay.
And again, September 30th is the date we've chosen based on conversations with our vendor, but we're optimistic.
Great. Thank you. Any other comments on either .100 or .101 application requirements? Okay.
Yep.
.102, action on applications. We have the same tolling issue here, is that correct? But any reason we shouldn't just keep it consistent with adult use?
I would assume that the commission would like me to conform to.
Yeah, no, that certainly, unless there's a good reason not to.
Yep.
Okay. .103, licensure and renewal. .104, notification and approval of changes. And this is totally consistent with adult use as well. We've made that change, correct?
Correct.
Thank you. .105, general operational requirements for medical marijuana treatment centers. Oh, come on. It's just in general. This is something transfers in general would be able to. Yeah. Computer's going crazy. My computer just skipped out. The next one is .110, is that correct? Security requirements. Am I correct in that? We went from operational requirements for MTCs now to, the next section is 110?
Yes.
Okay, so unless there's anything on operational requirements for treatment center and medical treatment centers, can we go to .110, security requirements for marijuana, medical marijuana treatment centers? .120, additional operational requirements for the cultivation, acquisition, and distribution of marijuana. .130, additional operational requirements for handling and testing marijuana and for production of MIPS. .140, additional operational, I'm sorry. Keep going. Okay. .140, additional operational requirements for patient sales. Commissioner Flanagan.
As a non-attorney on this commission.
As one of the non-attorneys on this commission.
As one of the non-attorneys on this commission. I don't know if this is an appropriate place to put it. You could tell me, but I would like to have some sort of language so that we can receive public comment on reciprocity for medical licenses from other states.
Can you, I'm not quite sure.
Well, this is as additional operation requirements for patient sales. My assumption is that if we were to adopt reciprocity and people from other states who have medical cards could come here.
Oh, I see. Okay.
And
No,
purchase their medicine, then there would also need to be a provision in this section to make that happen. I mean, we can have a policy discussion. I don't mean to throw this out there. I'm not sure where the appropriate place is to put it. But if there's some way that we could get feedback through the public comment period on what people are thinking about reciprocity and what that would mean for Massachusetts. I leave it to the attorneys to figure that out.
Yeah, I think, let's talk about that. I don't want, this is not why I just want to turf to our general counsel. If we're going to try to get some, put something in the regs, the draft regulations to get public comment, let's talk about that. I hate to turn far to my right, but you seem to be pretty creative about these problems with Commissioner McBride.
I would suggest putting in language under 2A2, where it says an MTC may dispense only to a registered qualifying patient who has a current valid certification.
Right.
And insert in the Commonwealth or another state with legalized medical.
Marijuana.
Yeah.
Chairman?
I guess, yeah, go ahead, Commissioner Doyle.
I was going to say, I think it's, they're just remembering the medical regs. It's sprinkled in a lot of different places, but I am happy to help the legal team run through
So
it.
I'd like to, before we get into how we might do this, I want to talk about whether we feel comfortable we should do this at this point in time, because this is not trivial. I first of all, personally, just make it clear, I support this. I just, again, want to make sure that we're not just rushing through important policy discussions, but if people feel very comfortable that we don't need to have an in-depth policy discussion on this, that we will insert language appropriately, get feedback, and discuss it as part of our final regulatory discussion in August, I'm perfectly comfortable with that, but I want to make sure that that's true for the other commissioners as well.
And again, I don't mean to put this on.
No, I
just think-
appreciate
think
you
now is
raising it,
the
Commissioner
time
Flanagan.
that we can obtain public comment from people across the Commonwealth and maybe even from other states who are looking to have reciprocity in New England. And then it'll give us an opportunity to have that discussion later on.
So what is on the table, I believe, is that Commissioner Doyle has kindly offered to work with our legal staff to take Commissioner McBride's idea of how to insert this in the language, just make sure that it's consistent across all the other relevant sections of the draft regulations, but put in language around reciprocity into our draft regulations in the manner I described. Is anybody opposed to that or uncomfortable with that?
May I add a caveat?
Yes, please.
I haven't checked, since this just came up, I haven't checked to the statute 94I to make sure there are any limitations there.
So we can talk about it, presuming
I'll include that.
presuming it does not violate the statute. Commissioner Tyler, you had a comment?
I support it. Just want to commend Commissioner Flanagan for bringing it up and commend Commissioners McBride and Doyle for quickly finding a logistical solution for it.
And to Chairman Huffman for facilitating the conversation. Come on, you thanked everybody but me.
We'll hold off on that one.
You get two of those.
I'm sorry, I'm getting a little punchy here. Okay, thank you, Commissioner Doyle, for Flanagan for raising that, and I appreciate the work in terms of getting that into the draft. Anything else on .140, additional operational requirements for patient sales? .145, home delivery. The change to the definition that we agreed to for adult use will be reflected appropriately in this section. Anything else on .145?
Just a clarification.
Yes?
I've seen it reported several places that there would be body cameras for medical home delivery, but there isn't, correct? I just wanted to clarify that for the public.
Our discussion on Tuesday was that there would be, is that correct? So that needs to be reflected in this. Has it been reflected in this section, General Counsel?
Yeah, so so as you indicated, the Tuesday decision was that there would be.
Right.
So we did not make any changes to those provisions. I could work to, is that my under?
I think the decision we reached on Tuesday, I realize it was not a unanimous vote, but we did take a vote and agree that we would impose those requirements on medical delivery. So I think we need to reflect that in the regulations. Does anybody?
Unless I've missed it, that's in this draft?
Is that, okay, let me just be clear.
Yeah.
So on Tuesday, there was a vote to maintain the body camera, Yeah.
Yes.
And so I don't believe, unless there was a number of staff in the draft in the last 24 hours, is that I did not make any changes to those provisions, but I could double check that they have remained the same since the earlier draft. I don't know what happened.
You were second.
I don't know if somebody else took it out. I'll address it to conform it with the
Okay.
policy.
Yeah, I guess, we don't need to get into it other than it needs to conform with what we decided and the language in the adult use. Okay.
Mr. Chairman?
Yes, Commissioner Doyle?
This is not related to body cameras issue, but
In this section, though?
delivery.
In delivery?
Delivery in general. It is a PSA to any municipalities paying attention. Delivery is something that we are looking at on the adult side, and I forgot to mention this when we were in the adult regs, but on the adult side, we are only delivering to places that have marijuana retailers authorized under the zoning bylaws. And what I meant to say when we were back there is that it is very important that you respond to our request for information regarding your bylaws or ordinances in your different towns, so we can make sure we know what is allowed in each of the 351 municipalities in the Commonwealth. PSA over.
Yep. Thank you for doing that, though. It's very important.
Now your note can go away.
Okay. Anything else on delivery? Okay. Dot 150, edible marijuana products.
Mr. Chairman,
Commissioner Flanagan?
is it possible to align the prohibited forms of edibles, the ones that we have listed in the adult use, and then just move them over here? I know that we have bears, likenesses, characteristics, blah, blah, but we have a whole list that's in the adult use.
Is there any objection to doing that? Commissioner Tattle?
I'm sorry, could you repeat it?
I just want to align the adult use side with the medical side, is that?
As it relates to
As it
edibles
relates to
that are allowed?
edibles, so the colors, the shapes, just the same things, so that they're not appealing to children. I know that children use medical, but I don't think there needs to be this quote-unquote gummies or whatever that are looking like teddy bears or whatever.
I think that's fine. I think we just should leave room in case there's a patient that has appetite issues or something where it would be different, but I'm fine with doing it for now.
Okay. Anything else on edibles? Dot 160, testing of marijuana and marijuana products. Excuse me. Dot 170, municipal requirements. Any other PSAs?
No, just please get those bylaws and ordinances back to us. Thank you.
Dot
So pleasant.
Dot 200, counties of Dukes County and Nantucket. Dot 300, complaints process. Dot 301, inspections and compliance. Dot 302, compliance examination. Dot 303, unauthorized purchase for purpose of investigative testing, secret shopper program. This is new that we've inserted just to be consistent with adult use, is that correct?
A lot of these last ones, yeah.
Okay. Dot 310, deficiency statements. Dot 320, plans of correction. Dot 321, administrative hold. .330, limitation of sales. .335, removal and prohibition of marijuana and marijuana products. .340, quarantine order. .350, cease and desist order and summary suspension order. .360, fines. .370, orders to show cause. .400, medical marijuana treatment center license grounds for denial of application for licensure. .415, void medical marijuana treatment center license. .450, medical marijuana treatment center registration or license grounds for suspension, revocation, or denial of renewal applications. .500, hearings and appeals of actions on registrations or licenses. .800, background check suitability standard for licensure and registration. .801, suitability standard for licensure. .802, suitability standard for registration as a medical marijuana treatment center agent. .803, suitability standard for registration as a laboratory agent. .820, confidentiality. .830, petitions for the adoption, amendment, or repeal of regulations. .840, non-conflict with other laws. .850, waivers. .860, notice. .900, severability.
Mr. Chairman?
Yes, Commissioner Title.
I'm not trying to be difficult.
You're not trying to be difficult?
I'm not trying to be difficult.
Okay, I'll be the judge of that, but go ahead.
I'm not trying to be difficult. However, the delivery memos that we discussed on Tuesday, I'm quite certain, unless it changed magically.
Could you get us to the section
does-
that you're-
Well, it doesn't. I don't have a section because I'm saying that something wasn't on there.
Okay, go ahead.
Did not include, I believe, body cameras for medical marijuana deliveries, and we didn't have that discussion.
That is accurate, and the discussion that we had was about cameras in the vehicles. It wasn't about
Not
body
body
cameras.
cameras. Okay, fair enough, sorry. So what specifically are you going to suggest?
Well, I'm going to suggest that we hold off on that until fall, but if people feel strongly that it needs to be implemented, that we then have the discussion now about whether it's necessary.
I'm sorry, I didn't hear the second half of what you were suggesting, I apologize.
I would suggest that we hold off until fall on imposing that requirement. However, if people feel strongly that it must be included now, then I would suggest that we have that discussion now
On body cameras?
for medical deliveries.
But you're not debating in the vehicle cameras?
Right, that discussion's over, I
Okay,
understand.
Okay, so can I get some Thank you very much, and I don't think you're being difficult at all. So,
Thank you.
Can I get some comments from others? Do we want to have that discussion now? Do we want to defer? I agree that we have not resolved this issue, so it either we have the policy discussion now or we defer to the fall.
I would
Those are the
suggest
two
that we
options.
defer to the fall, because I think that the public comment period during the adult use process is probably going to be illustrative.
I am fine with that. Are others fine with that? Commissioner Flanagan? Commissioner Doyle?
Yeah, the only moment I had in my head was maybe it makes sense to just have one big body camera discussion, but if it makes sense to do it in phases, I'm fine with that too.
Okay, so we're going to leave that out and defer the conversation to the fall regulatory cycle. Okay, great. Thank you. I really appreciate you bringing that up. Are there any other issues before I ask for a motion on CMR 935.501? 935 CMR.501. Then I'd like to ask for a motion, please, to approve the draft regulations as distributed by staff yesterday, subject to the modifications that were agreed to by the commission this afternoon, and again, delegating the authority for ministerial and formatting and editing or grammatical editing changes to the executive director and the general counsel. Have that motion, please? Have a second, please?
Second.
I'm going to go with you, Commissioner Doyle. Let the record show Commissioner Flanagan made the motion to approve, seconded by Commissioner Doyle. All in favor?
Aye.
Let the record show the Commission unanimously approved the motion. I know I'm sounding like a broken record, but my deep thanks to the staff and to the legal team. A formidable amount of work. I think the fact that we got through it, in the time frame we did, as smoothly as we did, is another testimonial to the quality of the work. And so, thank you. I really also want to thank my fellow commissioners who clearly have been giving up a lot of their sleep, reading regulations and being very diligent and thoughtful about them. And I think we've ended up in a really good place. So my thanks to everybody involved. There is no further business that I am aware of in front of the commission. If I can go to the next meeting date. Why shouldn't we end the way we began? Where are you, Anne Marie? Oh, I think
Eric is here.
do I have to be taller? It's July 17th.
That's a Wednesday.
It's on a Wednesday?
Yeah. Not the 18th.
Yeah. See if we can get it. If we can't get it on this,
I'm sure everybody heard.
I like the formality of putting it up there, but if we can't get it up there in 30 seconds, we'll just ask for a motion to adjourn. Great, here we go. July 17th, 10 a.m., Mass Gaming Commission. There being no further business in front of the commission, may I ask for a motion to adjourn? Can I have a second?
Second.
Let the record show Commissioner Flanagan made the motion, seconded by Commissioner Doyle. All in favor?
Aye.
We are adjourned as of 3:17 p.m. Thank you very much. And for